Students, let's study direct diagnosis. So let's study direct diagnosis. So first step is sample collection, transportation and storage and then processing. So there are some general remarks for handling. So all specimens are collected before treatment. Collect specimen in adequate amount from infection site. Use sterile containers. Use gloves while collection and handling specimen to prevent the transmission of infection. Use of mask to prevent transmission of infection. Use of safety cabinets while working with respiratory pathogens. Universal precautions must be followed while procuring and handling specimen to avoid infectious agents. The specimen must be labeled properly, bearing the name of the patient, sex, age, hospital registration number, ward number, etc. It should be accompanied by requisition form bearing the corresponding patient's details, along with provisional diagnosis and any specific test to be performed on the sample. Samples are blood, swab up upper respiratory tract, pus, sputum, stool, urine, urethral cervical exudate, CSF, skin scraping, etc. Specimen transport. Most specimens transport time should not exceed 2 hours. However, there are some exceptions. Immediate transport within 15 minutes for CSF and body fluids, ocular specimens, tissue specimens, suprapubic aspirate, bone specimen. Urine added with preservative like boric acid transported within 2 hours. Stool culture transported within 1 hour. Anaerobic culture transported in Robertson cooked meat broth or any other anaerobic transport system. Storage before processing. Most specimens store at room temperature up to 24 hours. There are some exceptions. Blood culture incubated at 37 degrees Celsius immediately on the receipt. Sterile body fluids immediately plated on receipt, incubated at 37 degrees Celsius. Corneal scraping plated at bedside. Stool culture stored up to 72 hours at 4 degrees Celsius. Urine midstream or from the catheter. Lower respiratory tract specimen gastric biopsy for Helicobacter pylori stored up to 24 hours. Microscopy, compound microscope principle. A microscope is used to produce an enlarged and well-defined image of objects too small to be seen with naked eyes. The degree of enlargement is called magnification or magnifying power of the microscope. Parts are mechanical parts, base, stand, handle, and stage. Magnifying parts, optical lens system, objectives 4x, 10x, 40x, 100x, and eyepieces. The 10x is low power, 40x is high power, 100x is oil immersion lens, and 4x is the scanner. Illuminating parts, condenser, iris, diaphragm, and mirror. The uses of parts: base gives stability to microscope, stage to keep slide on it, objectives for magnification of object, eyepiece to see magnifying image, condenser to pass light from lamp, iris diaphragm to reduce or increase the amount of light by reducing or increasing the opening, mirror to pass sunlight on object. Types of microscope: simple microscope to see insects, compound microscope to see bacteria, fungi, parasites, electron microscope to see viruses, phase contrast microscope, examination of living material like spirochetes, motility. Diagram microscope, condenser is the important part to see spirochetes. Fluorescent microscope, diagnosis of tuberculosis by staining with the fluorescent lights. Compound microscope principle: rays from light source pass through the iris and fall on the specimen. Light rays are gathered by objective and magnified image is formed. Uses: morphology of bacteria, fungi, cell culture after staining, wet mount preparation for living organisms, motility, serological test. Dark field microscopy. Object appears bright against the dark background by use of special dark field condenser. Central opaque area blocks light from entering the objective lens. Peripheral annular hollow area allows light.
So we already saw the procedure. So that is, first you have to pour crystal violet, wait for 1 minute, then wash, then pour gram iodine, then wait for 1 minute, then wash under tap water, then decolorize for few seconds with acetone alcohol, and then apply saffron in with 1 minute, and then wash and then dry, put oil, and then see under microscope, oil immersion lens. Principle of Zn staining is the organisms like Mycobacterium tuberculosis, which causes tuberculosis, and Mycobacterium leprae, which causes leprosy, are acid fast. So that means they are resistant to acid treatment. So that is why it is also called as Zn stain or acid fast stain. So this acid resistant to acid treatment is because of the lipid containing in the cell wall of this mycobacterium, that is mycolic acid, and because of that they are not decolorized by strong acids and alcohols after they bind with the carbolfuchsin, that is primary stain. And then because they are not decolorized, they are not stained by counter stain, they are stained by carbolfuchsin, that is pink in color. That is why in blue color background or other bacteria are blue in color, pus cells, neutrophils are blue in color, and then you can see pink color rods of the mycobacteria, either tuberculosis or leprosy according to the sample. So in tuberculosis it is sputum sample, and in leprosy it is skin scraping. Media. So sticking on the plates is done this way. So it is first you have to take this, you have to heat the wire loop on a flame till it becomes red hot. Then wait for some time so it will be cool, and then after that you have to take the sample in wire loop and then do primary inoculation. Then from that primary circle you have to draw the lines horizontal, then rotate the plate, then again draw the lines, then rotate the plate, again draw the lines. So this, and then after that tail in the end. So this is primary, secondary, tertiary and quaternary inoculation you have to do, so that you will get isolated colonies to study colony characteristics. Now we will see biochemical reactions for the confirmation of the bacteria. So for gram-positive bacteria, that is Staphylococcus, we have to do catalase and coagulase test. So catalase, you have to take 1 drop of colony suspension, then add H2O2 and then see for the bubbles. So catalase positive in Staphylococcus aureus. Coagulase test can be done by slide or tube method. So you have to take 1 drop of colony suspension, 1 drop of plasma, add and see for the clumps. So positive coagulase test is seen in Staphylococcus aureus. Then biochemical test for the gram-negative bacilli is IMVIC, indole MRVP citrate. So indole, you can see this purple coloring in positive test, that is seen in E. coli. Methyl red, you can see the red coloration that is seen in E. coli. Urease test, you can see yellow broth, the yellow slant converted to the pink slant, that is seen in Proteus. Citrate test, the green slant is converted into the dark blue color, that is seen in Klebsiella. Then oxidase test, it is the purple discoloration, that is seen in Pseudomonas, Neisseria, Vibrio. The antibiotic sensitivity testing media is done on Muller-Hinton agar for the antibiotic sensitivity testing, and that is usually done by Kirby-Bayer disk diffusion method.
Hope you find this session useful for your understanding and for your exams. Thank you.